call this meeting to order. Whoa, that's loud. Sorry. Would you all join me in pledging allegiance to the flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, our first item on the agenda is to approve the agenda. Are there any adjustments?
Mr. Chair,
Mr. Sufferman.
yeah, I would like to make a motion that we flip-flop item G with item F on the agenda.
Okay. Can I have a motion to that effect? Or I guess, is that okay? Is that, are you considering that a motion, Mr. Sufferman?
Yes, I am.
Okay, so it's been moved and seconded to flip items F and G on the agenda. Is there any discussion? Hearing none, all those in favor of approving the agenda with the proposed adjustment, please signify by saying aye. Aye. All those opposed? Are there any abstentions? Okay, the motion passes. So we're going to move on to public forum. And a couple ground rules before we get started that I wanted to mention. If I can find this. Okay, because we're at an indoor gathering, we do have to work under the applicable state health orders. So if you or your family group, and I would even extend that to people that you hang out with, are sitting 6 feet away from another group of such nature, you are free to remove your mask or face covering. And as I look across, I see everybody kind of complying with that, so I do appreciate it. For public forum, there's a 5-minute time limit. Legal restrictions limit the amount of board comment and interaction during this portion of the meeting. You have you've been receiving the yellow forms from the board secretary, so I do appreciate that. Also, please refrain from any sort of derogatory comments about staff and trustees. If you have concerns of that nature, you can report those to Mr. Kramer or myself at a later time. So with that, we will start. First one is Stephanie Fisher. And as we go, because there's a 5-minute time limit, Miss Case will be timing for me. And then when you have 1 minute left, I'll just give you a quick little one. Okay?
Real
All
quick,
right.
Stephanie, just so you know, if you push that button there, that green light, you'll be set to go.
Okay, just like this, you can hear me?
Yep. Thank you.
Now, this is in reference to the masks, and you're wanting to skip to G as first, correct?
Correct.
Okay. So I have 3 kids that have always attended Goshen County school districts this year because of the mask policy in November. And some of the things that had happened with my children being in arguments with teachers and my middle son having some of his medical conditions, we decided to pull him from the schools, all 3 of them. And we took them to the Lusk virtual school so that they could continue doing classes without having to wear a mask. My middle son, he has, in addition to heart disease, a lung disease, that he has a dead part of his lung. And so the masks put him at greater risk. And we're aware that even those who have doctor's notes, they're not allowed to follow that, or they have to be in a classroom kind of by themselves. And so he still wouldn't have been able to participate with the other children if we had gotten a doctor's note for him. So we chose to pull them out. They miss school a lot. They miss their friends. And we have had to talk to them quite a bit about staying home and continuing to stay home until there is no mask requirements. I will say that I'm also a mental health therapist in our area, and we work with kids who come to our center every single day. And in the beginning, we talked a lot about COVID and what that meant and their fear of COVID. And pretty soon that changed. And that was not a fear of what's going to happen to me and a fear of what's going to happen to my grandma or grandpa or mom or dad. It became, this is the fight I got in today because of my mask. And this is why I'm frustrated. And we've seen a significant decline in mental health in the kids in our community because they are forced to wear their masks all day long. It is very hard on them. Even recently, we had a kiddo come to us and say, you know, all I wanted was a drink of water. And I couldn't get that drink of water because the teacher was down my throat to put my mask on. And that's just things our kids are put up against every single day. And so I'm really hoping that we can apply for this variance, and the kids that want to wear the masks can wear the masks. The kids that don't want to wear the mask don't have to. And the kids that can't wear the masks can go back to school so that they can be around their friends.
Thank you.
Okay, thank you.
Chris Alexander.
I didn't bring the equipment. I wasn't planning on speaking tonight, but I decided to change my mind. I work in an industry that has to do with hazardous atmospheres. And we have a machine called a CGI, which is a combustible gas instrument. And this instrument also measures oxygen, which is what's required, as you know, to live. And it is have certain levels of oxygen that's required by OSHA. And we did a test among ourselves with our instruments, and we tried 5 different kinds of masks, various types, even ones that were provided by our company. And sitting down in a resting position, you can take that instrument, slide it up underneath by the side of your cheek, not in front of your mouth, but underneath the mask in front of you by your cheek. And that instrument will go off because you do not have an adequate amount of oxygen. And so therefore, it is causing health hazards, really, that do not meet OSHA requirements. And you can do it underneath any one of your masks. I wish I would have brought my equipment to show you. Anyway, besides these masks that everybody has, they all say they do not stop coronavirus. So we're wearing something that even tells you that it does not work to stop the virus. Those masks that everybody's wearing, the best they might meet of any kind of standard is to collect dust. That's all they're going to stop. They're not going to stop anything else. So they're not stopping a virus. They're just going to be creating a health hazard that we may be not seeing right now, but it can affect us further down the line, and especially the children, because they're going to be more susceptible to acquiring a health hazard down the line because they're you know, they get out and they're moving around and doing things, it's affecting them physically and mentally. That's all I can say.
Thank you. Beth Keller. And I did forget to mention too, as you go towards the podium, if you're comfortable, you can remove your face covering to speak.
Thank you. So good evening. My name is Beth Keller, and I'm a nurse practitioner at Cowboy Clinic in Urgent Care. I am not here to argue for or against the mask mandate in the schools. I'm here to provide the board members with information about what I see at the clinic in regards to COVID in this community. Hopefully, the board members will use this information I give them to make an objective decision on whether or not to keep the mask mandate. To start off, the COVID symptoms vary significantly. Obviously, the more common symptoms, fever, nasal congestion, cough, shortness of breath, and of course, the loss of taste and smell. Other symptoms can include nausea, vomiting, diarrhea, a rash, body aches, fatigue, headache, and sore throat. So not only is there a wide variety of symptoms, but the severity of the symptoms varies significantly. Now, specifically to school-age children, they do really well with COVID. I tend to see kids that feel like they have a cold, or a sinus infection. I do not normally see the more severe respiratory symptoms in kids. However, there have been some kids that complain about their chest hurting. Also, the COVID infections in kids tend to be not as long as in the adult population. So with this young age group having cold or sinus symptoms, which is actually COVID, I do worry about COVID being missed, assuming that they just had a cold, and then the COVID being passed on to the more vulnerable population. I know that public health is working hard to get the vulnerable population vaccinated, and I applaud their efforts and all of their hard work. I've been asking patients if they are going to get the vaccine or not. And honestly, it's about a 50-50 response. And I'm sure most of the board members are aware that the peak of COVID here in Goshen County was in November through December. Those months were very busy and very stressful. The number of testing has gone down significantly since December. I have had some days where I do not test anybody for COVID. However, those days are not the majority yet. So today at the clinic, I tested 4 patients for COVID. For kids ages 4 to 19, we have tested, since the start of the COVID testing, 260 patients. Of those, there were 36 positives. Now, take that with a little bit of a grain of salt. Because if a parent tested positive for COVID and the kid was having symptoms, I did not make the kid test for COVID. The kid was a presumed positive. One of the reasons for that is because the test is obviously not a very pleasant test, and I did not want to traumatize the kids. So another set of numbers to make note of, the same age group, ages 4 to 19, the number of influenza tests that Cowboy Clinic ran in 2019 was 91 tests, and we had 47 positive flus. In 2020, plus the 3 months of 2021, we tested 142 influenza tests, and we had 8 positives, so significantly down. Another item I'd like to make the school board aware of is the increase in patients who test positive for COVID months ago, but are still having issues with their breathing. And I don't know if you guys have heard of the COVID long haulers or not. Basically, a patient who has, quote, recovered from COVID, unquote, but is still having symptoms months later. So in February, I started to see these COVID long haulers coming to the clinic. Also in February, I saw an increase in severity in COVID. 3 patients were placed on oxygen, home oxygen. 2 of those patients were in their early 30s. And for reference, we did place only 1 patient on home oxygen during the fall months. So as I stated in the beginning, I am not arguing for or against the mask mandate. I know this is a very emotional issue for a lot of people. It's very emotional for us providers because we don't have a cure for COVID. I'm sure Mr. Miller can agree with me that we as healthcare providers are doing everything we can to help our patients through this disease. Believe me, it's very frustrating to have to put a previously healthy 31-year-old on home oxygen. And I really wanted to give the board an objective view on what I was seeing at the Cowboy Clinic. The board decides to remove the mask mandate or keep it for the last 6 to 7 weeks of school, then we will support whatever the board decides. We'll be here for the community and help the community through this pandemic.
Thank you. Marie Glenn.
As a parent of children who have medical conditions, I can present information that would support them being medically exempt from wearing a mask. But since I'm not a medical professional, I didn't think that it would make a difference to you guys. And that comes from a history of turning in information and it not being accepted. I asked at the Smart Start planning meeting, what would happen to students if they decided to, or if their parents decided to fill out the information to be mask exempt. I was told that nothing would happen. Well, that was false. Many parents may not know that Wyoming State Statute 35-4-113, they may not know about it, but they need to be aware of how far our district can go to make medical decisions for our students. And it doesn't stop at masks. In subsection A of 35-4-113, it says, except as provided by subsection B of this section, the state health officer shall not subject any person to any vaccination or medical treatment without the consent of the person. Now let's move on to subsection B, where it was very interesting. During a public health emergency, which we are in, the state health officer may subject a person to vaccination or medical treatment without consent in the following circumstances. Subsection B1. If the parent, legal guardian, or other adult authorized to consent to medical treatment of a minor child cannot be located and consulted, and the vaccination or medical treatment for the minor child is reasonably needed to protect the public health or protect the minor child from disease, death, disability, or suffering. But what does that include? How far will it go? Nobody knows. That's all it says. Subsection B2. If the person authorized to consent on behalf of an incompetent person cannot be located and consulted, and the vaccination of or medical treatment for the incompetent person is reasonably needed to protect the public health or protect the incompetent person from disease, health, death, disability, or suffering. What defines incompetent? Sounds like we've got some things on our hands that we have to be aware of. If a person withholds or refuses consent for himself, a minor or other incompetent person, when vaccination or medical treatment is reasonably needed to protect the health of others from a disease carrying the risk of death or disability, then the person for whom the vaccination or medical treatment is refused may be quarantined by the state health officer. Meaning, what? Are we gonna take our kids for not consenting? We have a lot of questions. Masks are just the start. I have a laundry list of things that I could say about what I hear from the kids, but it's not my job to do the he said, she said. Our kids are suffering every day at the hands of control that has been implemented by the board. There was no governing anything really about how they did it. I am over listening to how poorly our children are treated. These kids deserve better. These kids are amazing. We have awesome students who try every day. They show up. It's hard. It's harder with a mask. I could go into medical stuff, but like I said, I'm not a medical professional, so it's not going to matter what I say. We have medical issues in our family, but unfortunately, we have to choose. Because in our building, this building right here, we've got a problem. So, to conclude, obviously I'm against the masks, but I'm against it for a little bit of a different reason. Control is not to be taken out of context. We need to have respect between everyone and not just listening to somebody telling us what we're going to do and then threatening us. Thank you.
Thank you. Yeah, I have three on this one: Maddie Jones, Lauren Orr, and Sierra Allen. You're welcome to come up together, but I will also afford you, all three of you, your allotted 5 minutes if you desire.
Okay, so we are part of the student body at THS, and we just wanted to give you guys a different perspective since you're hearing a lot from the adults. and the parents and the teachers. So first of all, we would like to apply for this mask variant because we've seen a lot of other schools in the Wyoming and in the districts that have lifted their mandates, and I just think it'd be unfair to students at THS if we didn't get to lift it as well. And another thing is like we're high school students, we're teenagers, we're not robots, and like we just want to be able to have the option to not live under a mask for 8 hours of our day, like throughout the week. And we're just kind of like missing out on some high school experiences from it too, because like we missed the state tournament last year, and this year, you know, our like with our athletics, our spectators were lowered, so like not all of our family or friends or like student sections could come watch, and it's just kind of like unfair to us that we have to deal with that in our high school experience, and we only get 4 years for.
I also know that a lot of students have problems with teachers and masks, and I have been written up for not wearing my mask correctly, and I have been talked to and argued with teachers about it. And a lot of the students don't really wear their mask correctly, so I don't see why it is still a thing. It doesn't really matter as much if someone's not even wearing their mask correctly. Also with sports, we kind of don't play with masks on anyways, and we're around our team 24/7. And we hang out after school events, we hang out at home, we basically pretty much all your friends, you go to school with them, you pretty much like live your lives with them, and you never wear your mask other than around in a classroom. And also your teachers, even though you may be wearing yours, sometimes they may not be wearing theirs. And I think that should be a choice, whether you wear your mask or not.
Yeah, we just think that like it should be an option if kids are scared or if they have like family members that could be like more susceptible to it. We just think like they should be able to choose and we should be able to choose. We don't want to wear masks, we don't have to, but if they want to keep themselves and their family safe, then they can do that. And we just like don't want to live in fear anymore. Like we've been through school for so long and there's always been sicknesses and we've never had to wear a mask until this year. And we just would really appreciate if we didn't have to wear a mask anymore.
Thank you.
Thank you.
Thank you, ladies. Danielle Murphy. Oh, and I'm sorry, it looks like you have a couple family members that want to speak also. They're welcome to join you or they can come up after. Up to them.
All right, they're kind of nervous.
Okay, that's fine.
We all
Whatever
are.
you want to do. I just wanted to afford that opportunity.
I don't think my son's going to. Can I go ahead and read what he wrote?
Absolutely.
Okay. His name is Evan Hellis, and it says, I'm an 8th grader at TMS. I've experienced some discrimination and inconsistencies this year regarding the COVID rules. One specific incident happened today. In one of my classes, I always use a plexiglass divider so I can remove my mask. Today in that class, we were working in pairs. The teacher told me to just use my mask instead of the divider. When I told the teacher I did not want to wear the mask and use the divider instead, the teacher sent me to the hallway for the rest of the class. The teacher did not give me the option to use a divider instead of the mask. I was not the only student without a mask, but I was the only one punished. Please apply for a variance so we can get back to normal and I can focus on learning. Okay.
And you're Logan.
This is Logan Hellis. It says, I'm a 5th grader at Trail Elementary and I don't attend in-person school because of being forced to wear a mask. I have no problem with those who choose to wear a mask, but I want to be able to decide for myself whether or not I do. All of my teachers in my school have been offered the vaccine. It shouldn't be mine or my peers' responsibility to keep them healthy. I would love to go back and attend in person for the last 2 months of elementary school. Please apply for a variance so students and staff have a choice.
Thank you.
Okay. My name is Danielle Murphy, and I've lived in Goshen County my entire life. I have 4 kids, 3 who are enrolled in Goshen County and 1 who's enrolled in private school. I come before you tonight to ask that you apply for a variance for our school district to remove all restrictions, to give every parent, student, and staff member the choice. I'm not asking you to be the expert. I am asking you to at least apply for the variance and let the experts make the decision. I have provided you with a petition that has over 800 signatures to support this. There are many counties in the state that have accomplished this and a few that are in the process. Weston County School District number 7 and Niobrara County School District have been given approved variances. Platte County School District has a pending variance application. Sublette County School District board members voted to discontinue the use of the Smart Start plan altogether without applying for variance. I have provided each of you with their information as well as a section of the public health order that their variance is covered. When the governor announced that he was lifting the restrictions from the general public in the state, I took it upon myself to seek additional information regarding the schools. I called the governor's office and spoke to the secretary. I also reached out to Lachelle Brandt, who is the senior education policy advisor for the state. My question to them was simple. Why has the statewide mandate been lifted for the general public, but not from within our schools? The information I gained from both of them was the same. It was because the teachers who wanted to be vaccinated hadn't had the opportunity to. On March 19th, Goshen County Public Health advertised that vaccines were now available for anyone 18 years and older. I have confirmed with Mr. Kramer that all of the staff in the Goshen County schools have been offered this vaccine. He informed me that 41% of all staff have received the vaccine. This now means that every adult in our county who wants the vaccine can get one. The main reasoning for keeping these restrictions on our kids at school was to protect the vulnerable until they can be vaccinated. They've done their part, and they deserve to finish the school year without the masks and the restrictions. Every adult in Goshen County who feels like these kids are a threat now has the opportunity to get vaccinated and take responsibility for their own health. This is not the burden our children should continue to bear. I understand there are only 8 weeks left in school, but our children have done their part. It's time we send a clear message that we are advocating for them by applying for this variance.
Thank you. I'm going to apologize if I pronounce anybody's name wrong. I have Andrielle Walsh. Did I say that right? Okay.
Okay, so I'm Andrielle Walsh. I have been a resident for 15 years, a Wyoming resident for life. I just want to say this is not normal. Like, I look at you, but you're talking. That's not normal, right? Because you guys are, I can't, I can't see your mouths moving. So my first point is my youngest son is hard of hearing, and masks make it difficult because they muffle voices. It makes it hard to read lips, and facial expressions are really important, especially for kids, man. Really, they are. My son looks at everybody's face. He wants to see like what you're feeling. He wants to see your lips moving. This isn't normal. Firsthand, I've seen other adults, including myself, having issues with that. And it's uncomfortable for hearing aids. We are breathing our own breath. That's not good. I mean, that guy just gave you some pretty good tips. Like, they've tested it themselves. With that being said, my asthmatic son and my asthmatic bonus daughter, they've had problems wearing these masks. They've gotten dizzy, they've shortness of breath, and then they're wearing them in PE. Seriously, guys? Do we want our kids to pass out and like have more medical issues? I just don't get it. And recess. These poor kids. It's a shame what they're doing to our country. What's the point when they're up, all of us are going to the bars and to the stores, without masks? What's the point? Why are our kids wearing masks? Why are they wearing masks when we're all drinking out at the bars or, meeting at restaurants for dinner? It doesn't make sense to me. What it's going to get passed around, it's going to get passed around. It's probably no worse than the flu, like they've said. I feel like we're in a Monsters, Inc. episode 4319. Oh my gosh. You know how scary this is for kids? Like, dude, they're looking up at you and you've got like a mask and a face shield. Oh Oh, no, 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 no. I'm just not having it. They're wearing them walking to and from school. What's wrong with us? There's fresh air outside. We should be breathing it. I don't get it. Save our children. You know, it's not a big thing in this small town that, you know, all our children are getting abducted and stuff. But with masks on, can you see their faces? No. Can you identify them? Probably not. It's ridiculous. It should be a choice. Go ahead, wear your mask, but I don't want to. And I don't want my kids to wear them. I really don't. It should be a choice. Go ahead and smoke, but don't blow it in my face, please. Please apply for the variance, not only for this year, but for our future. Thank you.
Thank you. I have on next Ben Hager. And if Afton wants to come up also, she can, or if Dad wants to read it for her, that's fine too.
I think Athens gonna talk on her own.
Okay, that's fine too. I just wanted to give you that.
Yep, thank you. Thank you. So I want to start out with asking every one of you a question here. How many people came here wanting our kids to have a choice to wear their mask or not? Stand up. Everybody stand up. And remain standing up for the next 2 minutes. The reason we're here tonight is, as you can see, to make a stand and fight for our freedoms, to fight for our kids. Over the last years, many, many years, we have slowly watched our rights and our freedoms be taken away from us. We have the freedom of speech, as long as we don't say anything that could possibly offend someone. We have the freedom to give our opinion, as long as it doesn't go against the narrative. Our children are being taught to shut up and to comply, to not go against the grain, to fall into line and accept what is naturally and morally wrong. As parents, it's our God-given right and job to protect our children, to take a stand for their rights. And we need to set an example for them to follow, just like our founding fathers set for us. If we don't stand and demand a choice for our kids, what comes next? That's a question that many of us are asking ourselves. What comes next? Mandatory vaccinations? Tattoos on their forearms? When is this going to stop? And we have the power to stop it. You have the power to stop it right here at the local level, and that's where it begins. You know, one of the craziest things I've ever seen was right over here in the gym just a couple months ago. I came to watch the wrestling matches. And in those wrestling matches, those high school boys were as physically close together as two people could possibly get. At the end of the match, they couldn't even shake each other's hands to show respect. As we all know, the line of stupidity has been crossed. How much further are we going to allow ourselves to go? We can stop this. We can stop it at the local level tonight. You have the power to do that. We are Americans. We must fight for our freedoms and teach our children to do the same. Our job as parents and teachers is to set an example for the kids. Is that example going to be rooted in fear or in bravery? As a father, I am trying my hardest to teach my daughters how to lead. If we do not teach kids how to lead, they will be led in directions that we won't like. So tonight I'm asking you to please give our children a choice. Look out in this crowd right now. That's why we're here. Thank you.
Thank you. I have to make sure you step up to the mic so we can hear you.
Mr. Chairman, members of the board, and our great community. My name is Afton Hager. I'm a sixth grader at Torrington Middle School, and I believe students and staff should have a choice to wear a mask at school, or in my case, to not wear a mask at school. If people can go to a restaurant and have lunch together without masks or dividers, we should be able to have a normal lunch at school also. I have played basketball and softball this year. Most of my teammates don't wear masks to practices or anywhere outside of school. While at school, several staff and students do not wear their masks over their nose and mouth anyways. So if students are not wearing their masks like they should at school and not wearing them all outside of school, then why do you think our positive case count in our school district is 0 right now and has been for quite a while? It's because the students are not the spreaders of the virus. The pressure being put on students and teachers to force this rule is awful. At one point, I was pulled aside by a teacher and was told to put my mask on because the teacher was going to visit his elderly mother that weekend, and if I don't put my mask on, I could be the reason she gets sick and dies. I'm 12 years old. That kind of pressure and fear is being put on us kids because of these masks. If you vote to apply for this variance, it would take away a lot of stress from students and teachers, and we can get back to learning. Please, for us kids and teachers, make masks optional. Thank you for your time.
Thank you, Afton. Karen Poston, did I say your last name right? I'm sorry if I didn't.
I'm Karen Poston, and I wanted to thank you, Superintendent Kramer, and the board for allowing us to come and to voice our opinions. I didn't come prepared tonight. Well, actually, I did. I did like a whole bunch of research, and I wrote it into a speech, and then I thought, you know what? I'm not going to talk because I'm not going to change anybody's mind. And then I got here and I thought, you know what? I have done this research. I have an opinion, and it's okay for me to get up and talk. So that's what I'm doing. When I started to decide what I wanted to say, I was like, well, there's charts, there's data, there's articles, there's videos, and I looked through a lot of them. And then I thought, you know, there's different opinions, so I can pull up things to support what I believe, and someone else can pull up things that support just the opposite. So I'm not even going to go there. One thing I did find, however, is that a lot of the experts do agree on a couple of issues. The CDC and Dr. Joseph Picola, who is a board certified family physician, who's also a natural health advocate and does sell health products. They both published in separate reports that children aren't super spreaders. Schools are not super spreaders. In different surveys and different reports that they have followed, the incidence of cases in schools actually tend to go up and down with the community incidence of COVID rates. It's also been proven that it's more likely that there's going to be staff-to-staff infections, not student-to-student infections, and not student-to-staff infections. This actually can be seen in our own Goshen County percentages, where 4% of students have actually been tested positive for COVID, and approximately 14% of the staff is 13.something%. This, along with a report that Dr. McCullough had published on his website, and I sent that to some of you through email, whether you had a chance to read it or not. He reports that parents are reporting that so many of their children, it was up to 40% in some of these cases, have experienced headaches, dizziness, fatigue, reluctance to go to school, fear, anxiety, shortness of breath, difficulty learning, difficulty paying attention, and a lot of added stress. And so the above items that I talked about, that children tend not to be the people that infect or get infected, along with all these issues that have been brought up by the parents, makes me wonder, have we really helped our children or have we hurt them? There is one thing that I have noticed on my own from observations of attending activities here at the school. I feel that we have taught our children this year some very poor things. First poor thing that we've taught them is fear. Fear each other. Fear your friends. Fear breathing fresh air as I see them walking to schools in their masks. Fear of a virus that is here to stay. It's not going to go away. Whether you're vaccinated or not, you can still get the virus, you can still spread the virus. It's not going away, and they are scared to death of it. The other thing that I know that we've taught them is bullying practices. Wear your mask, or we're going to tell on you. Pull it up. Even with doctor's notes, we're going to isolate the children that can't wear the mask. Difference of opinion is not going to be tolerated. And then the last thing is that not all activities are equal. We can wrestle and be as close as you possibly can. We can play basketball and be face to face, breathing on each other. But we cannot sing and we cannot have drama or any acting activity without wearing a mask. The last thing in closing that I want to say is, why not now? We're not asking for you to say no mask, but we're asking for you to give us the choice. What are we waiting for? Is the mortality rate ever going to get to 100%? I kind of doubt if it's ever going to get lower than it is now, even with vaccinations or anything. Thank you.
Thank you. Andrea Wonderboy.
Hi there. I'm Andrea Winnebald. I have a junior at Torrington High School. There's been a lot of really good conversation tonight. I appreciate everything everyone said, but I'm going to be the voice that's going to say that I'd like to keep masks. The high school kids were not able to have soccer, track, prom, end of the year band and choir concerts, award banquets last year. And I really hate to risk that. I really want them to get a chance to finish that out this year. And I'm nervous that if we don't stay diligent, that we'll have another outbreak. My daughter's a band and choir kid. And she's nervous. Okay, at our last concert, we got to have an auditorium. It was so wonderful to have them in the auditorium. And she's worried that they're going to have to spread out. And I don't know the answer to this. Are they going to have to be 10 feet apart, 6 feet apart to sing or to play their instruments if they don't have masks on, as that isn't possible on the stage? And can we sit in the audience if we don't have masks on? That's important for me to know. I also worry about if kids do get sick, are we going to have to quarantine an entire classroom? Whereas now they're saying that if you have a mask on, you don't have to quarantine. But, a kid that has 8 classes in a day times 25 or whatever, that could be a lot of kids being quarantined.
So those are my concerns. Thank you.
Thank you.
Mr. Chair.
Yes.
Mr. Chair. Can we just have a reminder that as people are coming up to speak, that no matter what position they're voicing, that comments, paralanguage, anything that is, I guess, against the position that's being voiced, we refrain from making this type of comments.
Yeah, I understand. So I'll repeat it. So if someone comes up and they say something that is against your position, please respect their opinion. We're all here working together to try and make the best decision for our kids. And so we need to hear everybody's points. So just please be respectful. The next person on our list is Reese Robertson.
Yes, hello, can you hear me good? My name is Reese Robertson. I am a senior at Southeast High School. And first, I'd like to start off by saying thank you for giving me the time to express my position as to why we should apply for a variance that would eliminate the requirements of masks in schools. It has been proven through studies promoted by the CDC that teachers and students were at less risk to transmit the virus to each other than they were to contract the virus outside of school. The first study I'd like to talk to you about was done in the UK by the Office for National Statistics. It states that teachers are not at no higher risk for COVID-19 than the general public. It states that baseline risks for teachers is about 0.014% as opposed to all adults that are at a baseline risk of 0.024%. With vaccines rolling out and all of our teachers being vaccinated or have had the opportunity to be vaccinated, that baseline risk is significantly lower and will be as close to 0% as it ever will be. Once you get to a vaccine, there's nothing more you can do to protect yourself from the virus. The CDC has also presented evidence that is found in another UK study, and this one regards teacher to student transmission. And the evidence shows that, the evidence suggests that staff to staff transmission is more common than students to staff, staff to students, or students to students. The best precautions that adults can take against the transmission of COVID-19 is a vaccine. That was the whole national push for almost a whole year, was once we get the vaccine, we can go back to normal. And with all these vaccines that we have received in record time, they're more widely available and there are no more precautions you can take that will lower your risk from contracting the virus. The CDC also found in the UK study that detection of cases in schools does not necessarily mean that transmission occurred in schools. The majority of cases that are acquired in the community and are brought into a school setting result in limited spread from inside schools. These are from our own CDC. Also, this head of the CDC, Michelle Walensky, I think is what her name is, she even stated that vaccination of teachers is not a prerequisite to safely reopen schools, and that was the schools that are still closed. We were lucky enough to be reopened, but most of our teachers have had the opportunity to be vaccinated. The whole statewide mask mandate has been lifted. Vaccinations are up in Goshen County, in the state of Wyoming, and the whole country. Infections are down in Goshen County. When I last checked, our case number is 4, and the infection rate for the whole state of Wyoming is down. The infection rate for the whole country is down. These are just the simple statistics that the Wyoming Department of Health and the CDC show every single day. We need to see a benefit to having a vaccine, but by forcing a mask mandate in schools, it's just completely negating the whole purpose of getting a vaccine. The baseline level of risk for everyone is getting lower every day. If we aren't able to live normal lives with a baseline risk of COVID of less than 0.1%, then why do we even step a foot outside of our homes? I respectfully ask you that you vote in favor of a mask variance tonight. Thank you.
Thank you. Amber Buchanan. Amber, I apologize. I didn't realize that he was your son. Otherwise, I would have had you come up with him too if you wanted.
No worries. So I just want to, I understand that there's a time and a place for masks. Totally get it. Healthcare setting, wear a mask, I'm okay with that. But with the spread among school-age children being so low, and with our community, our public health has been excellent in rolling out vaccine. Banner has helped roll out vaccine so that Goshen County is vaccinated and covered. And we have done, I feel at Goshen County, we have done our part to get the vaccine out, which is the national push. That was the matrix that we're going by, is we need a vaccine, we need a vaccine, we need a vaccine. And so now that we have it, and Goshen County is down to 4 cases per the population, I think it's like 0.400% of infection. I feel like the least that we can do is let our kids unmask for the last part of school. The least is our children. I get vaccinated, I wear a mask for my child to be in school. And I feel like we are at a point now that we're at, like, we see light at the end of the tunnel. So the least that can happen is our kids can go back to some type of normalcy. The one thing I do fear, if people do not see a benefit from getting the vaccine, they're gonna not get it. And people are apprehensive about getting it anyway. But if they don't see a benefit, they're gonna wonder why. They're gonna wonder why they're getting it. So I respectfully ask you guys to please apply for a variance for our children, at least, to be unmasked for the remainder of the school year.
Thank you.
Thank you, members of the board, Ed Buchanan. And I wanted to start off by addressing the agenda, and the recommendation that is before you is to approve not applying for a variance for the remainder of the 2020-2021 school year, and to reevaluate county metrics in July of 2021. And I know you can't respond to me, but I'd like to ask you, upon what matrix or metrics was that motion made or that recommendation made? And so tonight, I would like to address some of the statistics that come directly from the State Department of Health, and suggest to you that you should be guided in those matrix in making your motion as to whether or not you will apply for a variance to the mask mandate. And the first metric that you should consider is active cases. It was stated just a moment ago, we have 4 active cases. They're dropping every day, as a matter of fact, and that's like 0.03%. The best we could be at, folks, is 0%. The amount is infinitesimal. It is nothing. 4 cases in our population is 0.0003. That's the first metric. The second metric you should look at is lab confirmed cases over the past 14 days. That's what we use at the state. The state mask mandate was lifted on March 16th, when we averaged 53 lab confirmed cases over 14 days statewide. 53, keep that in mind. What does that equate to? When you compare that to all the county's lab confirmed cases over 14 days, that's 8% of the statewide total. So at 8%, the governor decided to lift the statewide mask mandate. Goshen County lab confirmed cases over the last 14 days, as compared to the statewide total, is what? It's not even 8%, it's 1%. And I would say to you, if the state can lift the mask mandate at 8%,
certainly you could at least make the motion to apply to the state to get their judgment and their objective view when we're at 1%. Those are the two metrics that you should consider. How do I know? I head up, and I'm only speaking for myself, my family, and my community tonight, not speaking for the state, but I had run the COVID interagency group. I'm the one that coordinates the State Department of Health, that put PPE all over the state when the pandemic started. I've been dealing with this for a year plus, just like all of you, but perhaps more intimately so. Keep those statistics in mind. Why do they matter? Here's what we use at the state. This is the White House COVID-19 Task Force Guidelines. Came out under President Trump. They are still in effect as of March 2021. It's dark red zone, which is very high transmission levels, all the way down to the dark green zone, lowest transmission levels. This is available today on the website. It's up to date. With the numbers I gave you, Goshen County, those numbers place us in the dark green zone, which equates to the lowest transmissions possible, the lowest transmission levels, because we have 5 or less active cases. We have 4 today, and we have no skilled nursing or healthcare facility outbreaks. That's one metric. And the second one is our 14-day test positivity rate is 1.4. You can go on the back of this sheet and see exactly where we are, 1.4, and now our cases are down to 4. According to the White House COVID-19 Task Force, which the state of Wyoming follows, we are at the lowest transmission level possible today. And so I would ask you, why is the recommendation that you go forward and say, we're going to move that we approve not applying for a variance? Instead, it should be the converse, based upon the metrics and the science I just gave you. And you can go look it up for yourself. It's current as of today. I think the motion should be reversed. The motion you should make is approve applying for a variance for the remainder of the school year. And then, yes, reevaluate your metrics in July. Things could change, grant that. We're all in this together. We've all been fighting it together. But for the remainder of the school year, let's use the metrics that are right before you, current as of today. Let's follow the science and give our kids a break for the rest of the year and reevaluate in July. Thank you.
DJ Mackey.
Hi, I'm DJ Mackey. I'm a senior at Torrington High School. I'm here to talk about having the option to wear a mask. As you heard before me, a lot of people just want the option to wear one, make their own choice. When are we responsible? Since when have we been responsible for other people's health? When? You're accountable for yourself, correct? At our school, no one wears the mask correctly anyways. I wear them at all. There's no point. There was a point where wearing your mask was more important than your education. Kids were being sent home because they wouldn't comply. I have actually had first person encounter with our THS vice principal stating that masks at this point were more for compliance than they were health. That's coming from our school, a leader in our school. Weston County and Sweetwater County lifted their masks in school. And just like you heard from the gentleman before me, that we're at the lowest possible rate of getting it in the state. Why can't we have the option to lift it? Lastly is, if you look at all of the states in the United States, that the mask mandate free states are dropping in COVID rates, while the mask mandated states are still on the rise for COVID rates.
That is it for public forum. I do appreciate everybody taking the time to talk to us about your concerns. We do take them seriously. Next item on the agenda, item E, consider approval of offering a teaching contract for the 2021-2022 school year. The recommendation is to approve offering a teaching contract to Baxter Heinert as a special education teacher at Torrington High School. Can I have a motion, please?
So moved.
Thank you, Mr. Saucedo. Is there a second?
Second.
Thank you, Mr. Schmick. Any discussion? Hearing none. All those in favor of approval of offering a teaching contract to Baxter Heinert as a special education teacher at Torrington High School for the 2021-2022 school year, please signify by saying aye.
Aye.
All those opposed? Are there any abstentions? The motion passes. We're moving down to item G. Consider approval of applying for a variance regarding the wearing of face coverings for the remainder of 2021-2022 school year. Can I have a motion, please?
I'd like to make a motion that we do apply for the variance to remove the face coverings for the remainder of the school year.
There's a motion to approve applying for a variance regarding the wearing of face covering for the remainder of the 2020-21 school year. Is there a second?
I second.
It's been moved and seconded to do that. Any discussion? And I will start. And I'm going to take my mask off because I can't talk for long periods of time without one. Okay, first of all, I want to acknowledge and thank everyone for their efforts this year. I think we can agree that it was important to be in the buildings this year versus what we had to do last spring. So thank you to the administration, the principals, the athletic directors, the teachers and paras, the custodial and food service staff, all of our district employees, public health, the healthcare workers in our community, and equally as important, the students, parents, and guardians. Your efforts this year are the reason we have been able to stay in the school when so many places around the country have not been in their buildings near much, if at all. In fact, I read something the other day that only 2 states in the country have been in the schools 100% of the time this year. That is Wyoming and Montana. Not even South Dakota has been in the schools 100% of the time this year. And that is the reason we are having this conversation now. When we first had the discussion before school started, I voted to apply for a variance. My reasons were simple. First, I do believe it should be an individual's choice on what to do with their health. I was unaware of that particular section of the Wyoming Constitution, so I appreciated the learning opportunity there. Second, I voted for the variance because I did not feel it was our place as trustees to be making that decision, and we should be leaving that up to the health professionals and government officials. To that point that I was certain a variance request at that time would have been denied based on how things were going, but I was fine with that. I was not very eloquent in expressing all this during that meeting, which is why I had my comments written down this time, but those were my reasons. Today, my opinion stays unchanged to those 2 facts. Further, I believe we should be leaving this decision up to health professionals and government officials based on the data they use to make their decisions, which has been consistently applied to the other school districts that have requested variances. I feel through our Smart Start plan, we have implemented a number of measures that have prevented the spread of COVID through our schools. Masks are one of those things, but so are the cleaning and the distancing and everything else. I think the discussion tonight is really about just partially removing one of those safeguards, as we will be giving people the choice to wear a mask or not. And we had heard from our communities that some folks will continue to wear a mask as their choice. Personally, I respect either decision people make and will fully support both. I have seen this commitment from all 4 school districts thus far that have applied for and granted a variance. Johnson 1 in Buffalo, Converse 2 in Glen Rock, Niobrara 1 in Lusk, and Weston 7 in Upton. That the schools and the communities they serve explicitly support each individual's choice. They have committed to explicitly do what they have to get through the remainder of the school year. If we vote to apply for a variance tonight, and if it gets approved, I firmly expect and believe we would get that same commitment from our communities. I also believe freedom of choice does not mean freedom from consequences, though. Every decision we make has a potential outcome, both positive and negative. If you choose not to do your homework, if you choose to stay late after practice to shoot extra free throws, if you choose to go over the speed limit, if you choose to buy coffee for the next person in line, if you choose to mow the lawn before it rains, all have outcomes. A lot of times those outcomes only affect you, but sometimes they can affect others. So many of the comments I've heard over the last couple of weeks and tonight have been about the small number of people, specifically students, that have tested positive or have gotten sick. And I won't argue that point because I believe the data supports it. However, I feel one thing that has not come up enough is the amount of people that have to quarantine when there is a positive case. I've often argued that the subsequent quarantine recommendations are almost worse than actually getting sick. We want to give people the choice to wear masks or not by partially removing one of our several safeguards, but are the quarantine recommendations being loosened to that same degree? Students missed out on a lot of things last year, and we've talked about that tonight. Track meets, music concerts, festivals, end-of-year celebrations, and prom. And we were fortunate to be able to hold graduation even as at a later date. This is why I've asked Dr. Church to join us tonight. And Dr. Church, if you're here, if you wouldn't mind coming forward while I wrap up here. If we're going to talk about giving families the choice to wear a mask or not and removing one of our safeguards, we need to fully understand what public health is going to recommend in terms of quarantine and how those rules work. Another reason I asked for Dr. Church to be here is because I found the exception request by Weston County Member 7, and I thank you for who provided that also tonight. And that was approved by Dr. Harris. It appears to me that this is a form letter where you fill out the current health statistics and then attest to certain actions the school district will take in certain events. This letter was signed by their board chair. As your board chair, I want a better understanding of what is in this letter, and by signing what I'm going to be attesting to. More so, I want to understand this process better, so when I get approached in the grocery store about what all this means, I can actually sound intelligent when I answer. If my questions are answered and I better understand this process and we approve applying for a variance tonight, I'll gladly sign this letter. So Dr. Church, I have a few questions for you if you don't mind.
No, go right ahead.
Okay, first, thank you for agreeing to be here today. I think it's important that we work together in this process as we go forward. It looks like this variance request letter is something that would be a coordinated effort between the school district and your office. Can you explain to us this process and the timeline we're looking at? And I'm just curious because if we approve to apply for a variance tonight, it seems to me it would not go into effect immediately and we would have to wait until that process is complete.
I would expect that would be completed by the end of the week.
Okay. And is that's something that Mr. Kramer, myself, and you would work with you on? And
It's pretty simple.
Okay.
There's a form that the state uses that
Okay.
we just write down what we want, and that gets reviewed by the state health officer who runs it through the Attorney General's office. But in my experience with getting the county variance the week before the state variance, it was 1.5 days. It was very quick.
Are there specific provisions of the health order we can ask for a variance from, or is it in the entirety of the public health order number 1, paragraph 5, provisions A through G? For example, can we ask to just remove face coverings requirements as stated in provision B, but still maintain the distance recommendations that's in provision A?
Yes, you can ask for variance from all of that. And all the things that have been brought up as guidelines or directives from the CDC, they're all based on opinion for the most part. The data to show long-term results from the COVID doesn't exist yet because we haven't had enough time to see what happens. In my own opinion, if you guys apply for a variance, my signature will be there as soon as I get the paperwork. The emergency is over. The emergency for the COVID infection and rate of infection in the county has gone away. We're not going to get rid of COVID forever or ever. Probably it'll still be around, irregardless of how many people get vaccinated. There will be some people that will be susceptible to the unforeseen consequences of the lockdown lockdown and the masks has been much worse than anticipated, I think, by the people who originated it. The fear that was generated by the media to believe that if you get the COVID, you're going to die, which a lot of people took seriously. I think it was unfortunate that it turned out the way it did. Goshen County has had a variance since March 9th. It preceded the state, or it preceded the governor lifting the restrictions, but it didn't make a big splash because it was kind of, the governor's action kind of superseded that.
Sure. Okay. I'm sorry, I didn't mean to cut you off. I do have a couple more
Well,
questions.
I'm sorry, I answered your question.
No, you did, and I do appreciate your comments. In this variant, the variance request, one of the things that we will attest to is that we will continue to follow the isolation, quarantine, and other recommendations from public health. So just because it seems to me that some of this stuff has kind of changed as we've gone through the year. So can you explain to us the process of what would happen when someone at one of our schools tests positive under the current guidelines from your office if we're still wearing masks, if we are still under the health order?
Right now, if you test positive, you're supposed to be quarantined and isolated from other people that might be susceptible. I anticipate that will change in the next few months, but I don't think it'll happen right away. COVID was lumped in with more serious diseases that do require quarantine. But I don't see that changing. That rule will exist for the foreseeable future, that if you have COVID-19, you need quarantine.
Okay, so then for how many days? And then actually, you know what, we'll come back to that. So if we approve applying for a variance and it gets granted, what is the process then when we have a mix of people wearing masks and not wearing masks?
That's what I think should happen. If people want to wear a mask for their own protection, that's fine. In the medical field, when the doctor wears a mask in normal practice, he's not doing it to protect the patient, he's doing it to protect himself.
Okay, so how about I'm sorry, I looked down and I'm not watching you. I have a couple scenarios I kind of want to walk me through so I can understand, I guess, better. So take a classroom with 25 desks, and it doesn't even have to be full of 25 students, but 5 by 5. And we have a student A, front left, wearing a mask. Student B, front right, not wearing a mask. Student C, back middle, as far away from these other two as you can get, who is wearing a mask. Student C tests positive. Who has to quarantine and for how long?
You have the rules there in front of you, but if the exposure is greater than 15 minutes within 6 feet, which is not going to happen in that scenario, really.
Assuming there's other kids around them, but yeah.
Yeah, as long as you're maintaining that distance, the other people don't necessarily need to be quarantined.
Okay.
They may be reluctant to get tested, but they don't have to be quarantined.
Okay, so same classroom, front left, wearing a mask, front right, wearing a mask, middle back, not wearing a mask, middle back tests positive. Now who has to quarantine and for how long?
Student C.
Just student C?
Unless somebody else is within 6 feet for more than 15 minutes.
Okay, so basically what you're saying is that it's the same quarantine rules, whether the person who tests positive is wearing a mask or not.
That's for the quarantine.
For the quarantine. And so what about, so many of the concerns we've had tonight about applying for the concerns about applying for the variance are those things where we might miss things because of quarantine. So I'm trying to get to what is the real risk of missing things?
I think the bigger risk is what effect it has on the quarantine person. In the school age kids that test positive, The only consequence, really, the biggest consequence is being sent home.
Sure.
And staying home.
But we've seen through the year, throughout the year, that that was part of, I guess, one of my frustrations was the amount of quarantine students we saw throughout the year, not necessarily because they tested positive, but because they were in close contact with somebody who tested positive. So that's what I'm trying to get at. It's okay, so if we take the mask off, and we've given them the choice, right? You can choose to wear the mask or not. And so we have somebody who chooses to not wear a mask, but then tests positive, at least from the past precedent, from what we've been seeing from public health, state health officers, is that even though the choice would, we're quarantining more kids than the one that tested positive.
And that was called an overabundance of caution, I think.
Okay, so I guess what I'm getting at is then what are we to expect then going forward? Are we using an abundance of caution, or are we gonna, or what?
I'm not sure what the question is.
Okay, maybe.
Can I ask one question?
Sure.
Just a clarifying point. So just to go on Chairman Jesperson's questions there. So if Mr. Kramer tests positive, doesn't have a mask on, Mr. Chairman Jesperson and I, neither one have masks on, are sitting apart from each other, close to him. We've been here longer than 15 minutes. Will we be required to quarantine per the new standard? I think that's the clarifying question. That's what the CDC lists. I just want to make sure if that's what the state of Wyoming and Goshen County are following.
That's the written rules, and I don't think that'll change. Whether people comply with it or not, that's variable. From a public health standpoint, somebody that's sick can be quarantined and should be quarantined in certain cases when the disease is significant illness. Many of the members of the community that talked tonight pointed out that originally we were trying to protect the weak and the ill and the old, and those people have all been at least offered the vaccine. And that was the result of public health doing a great job of organizing the clinics and getting it administered.
Okay, so when somebody tests positive and we do the contact tracing.
I'm not sure the contact tracing has been as effective as it could have been.
So what can we, I guess my question is then, if it hasn't been effective, then what are we going to do going forward? Because if we apply for a variance, we run the, I get what you're saying, but what I'm trying to get at is what is the risk of missing some of these things that we missed last spring? We got seniors who didn't get a junior prom. And if we vote to apply for a variance and it gets approved, and we give those people a choice to wear a mask or not, what is the risk that they're still going to miss their senior prom?
I'm not sure exactly what you're asking there either, but the school has already applied for a variance for the prom, and that's been granted.
Okay, I'm not talking about the prom, but if we have somebody who tests positive, and now we have to quarantine kids through the contact tracing, and it's for a period of time that extends over prom, how many kids potentially, even in my scenario, like where I pointed out where one person isn't wearing a mask because that's their choice, and we have other kids that are wearing a mask because that's their choice. Who is going to be isolated or quarantined in the close contact?
If you're wearing a mask and you're 6 feet apart, you're for less, anyway, there's a 15-minute close contact rule, and that's very open to interpretation of how close you get. Do I expect that it'll be a problem for the community if the school gets a variance? I don't.
Basically, what, if I can jump in just for a second.
Please.
So you're saying that those quarantine regulations, they're not going to change if a kid's wearing a mask or if they're not.
That's correct. Right now, COVID-19 has the same status as yellow fever or whatever, you know, that you have. It has that status right now. I don't expect that to last forever. I expect it to go.
Okay, and I guess one thing I probably should have clarified, there is a perception, or at least I've been presented with information, that if somebody is not wearing a mask and they test positive for COVID-19, that we would have to quarantine an entire classroom of people.
Well, I don't think that's correct. I don't think that's the way it is.
Is that the way your office would approach it? I mean, how would your office approach that if?
The sick person should be isolated and the other people would get tested or stay home for a couple of days and see if they get sick.
Okay.
But that's in the school situation.
Okay.
Okay. In the community situation, those people that are concerned about their health have been vaccinated.
Dr. Church, what if the person who's infected is the teacher? For example, a high school teacher who sees, 60, 70 students a day and circulates around the room.
I would hope he would stay home.
Well, but wouldn't we be required to quarantine all the students at least who are not masked?
If he was within 15 or for 15 minutes continuous, was within 6 feet and unmasked.
Does the health department or Trustee Miller or Superintendent Kramer, do you have any idea what percentage of our district employees have been vaccinated?
40-some%, I believe.
40%?
41%.
That's a fairly low rate, isn't it?
Okay.
Well, I know, but when we talk about vaccines, we're not protected.
The vaccine is estimated to be 90 to 95% effective, meaning.
But we only have 40% of our employees who are vaccinated.
So, and I'll help Dr. Church here.
This is Heather Saul. She's the Goshen County
Emergency Response Coordinator for both Goshen and Niobrara County. That's correct. Our teachers have been offered, but understand that we have a limited amount of supplies also. We have done 20 active or drive-through clinics, and each one we have done up to 200 vaccinations. And right now we just opened up to 18 plus. Can everybody hear me back there? The question that you're asking is in a classroom setting or like on a school bus, if one has a student chooses not to wear a mask and we do test positive, the ones around them will have to quarantine. If that student ends up getting sick or showing symptoms, then they will have to also isolate for however long. If they choose to test, then that limits their quarantine.
Her opinion is more valid than mine.
I think that's kind of what I was trying to get an answer to the information I was presented about an entire classroom having to quarantine if the person who chose not to wear a mask tested positive.
They would have to isolate.
Is there a higher impact of who gets quarantined if the person who tests positive chose not to wear a mask?
Yes, that is correct. They would have to quarantine.
They would have to quarantine, but would an entire classroom have to
It
quarantine?
depends on that 6 feet social distancing.
Okay.
So if the third person, if, like you said, student A is over here on the left side, and the one in the middle is wearing a mask, and the one on the right, as long as there's that 6 feet social distancing, the 15-minute rule.
Okay, thank
So
you.
yes.
I'm sorry I wasn't clear in my question, but thank you for.
I hope I
bearing-
answered that correctly.
Yeah, thank you for bearing with me and as we work through that. We did get a question, and it was one that I had, is what about the indoor events such as concerts? Will those be covered by the variance? It's my understanding that that's in provision E of paragraph 5. Does our variance affect that? So we're limited to how many people can come in for concerts, or they have to wear face coverings. The way, if we apply for that variance, does that allow basically parents to come in without wearing masks?
Yeah, if you apply for that variance. So we'll go off the capacity. It will come through public health and then Dr. Church. If he approves it, goes to Dr. Harrison. But yes.
Okay.
Yes.
We kind of touched on it, if we approve applying for a variance and if it gets granted by Dr. Harris, that also apply to, oh no, I was gonna skip that one. Never mind, you answered that. While it's not explicit in this variance request letter, it's my understanding that when we travel to other districts, we must comply with their rules.
That is correct.
It also says in this request letter that if transmission levels in the county increase or an outbreak occurs within the schools, the request may be revoked by the state health officer. And I think Mr. Buchanan touched on this also. So that basically means that if the data supports it, we have to go back to wearing masks.
That would be an option.
Okay. So, and I think Mr. Buchanan kind of touched on this specifically, but I want your opinion also. What metrics or data would drive that decision? Is it the test positivity rate? Is it the active cases per 100,000? All those?
All the above. And yeah, it's the amount of active cases and how many per, go ahead.
And the other variable that was not addressed in those was how many people were vaccinated.
Okay.
And who do we need to protect?
Sure. And so who makes that decision then if we're going to use that as one of our metrics? Or are we going to use that as one of our metrics then?
I really hate to project a what if, but that would be at the discretion of the Goshen County Health Officer with the support of the state health officer.
Okay. So I guess I do have one more question about, and it kind of goes back to our class, and I'm not going to rehash the classroom scenarios, but if we apply or we approve applying for a variance and it gets granted, in your medical opinion, what things can we also do to minimize the potential of, or minimize the number of kids that are quarantined, minimize the potential of losing out on those things again?
I think that the whole COVID experience has been an eye-opening thing as far as cleanliness and hygiene and keeping things sanitary, being aware of social distancing, all of those things have evolved. And so I think we would continue to do the things that are reasonable and unobtrusive to individuals' right to choose themselves.
Okay. Well, thank you for answering my questions, for bearing with some of the confusion that I caused. That's really all of my questions, and I do thank my fellow trustees for the extended liberty of the floor, because if it's my name going on the letter, I want to make sure that I understand what I'm signing.
If you go on the letter, mine also.
Yeah, and I appreciate that, and I want, like I said, I want to work together so we can make.
Yeah, united we stand, divided we fall. I totally agree with that. And by the other thing too is how many people have been getting tested. I get that there's the vaccine out there, but there's a limited amount of supplies. Also, there's that long-term effect too. If I get that vaccine, where's the long-term? Right now, this is what we know. Science is not black and white. There's a lot of gray area and it's changing every day. But it's also important to understand that too. I don't even know how to even explain that, but yeah, his name's gonna go on there, but understand also too that it goes both ways. How many of these students are getting tested? How many of the parents are not allowing their students to go in or their kid to go in to get tested? And so that's a domino effect right there also, so.
Yeah, I appreciate that, and again, I wanted just to get everybody on the same page here, because we're all, like you just said, we're all in this together. So I wanted whatever it was that you're saying to be presented to us up here, but also to the folks out here who have expressed concerns tonight also.
Yeah, I didn't come to advocate one way or the other, but
yeah. And I appreciate your contributions.
And just as an additional information, Heather and I have both been vaccinated with the vaccine. Because that's my personal choice that it's the best thing for me to do.
Sure.
Can I ask?
Yeah, I'll use it. I think we have more questions for you, Dr. Church.
Well, for either one of you, I guess my question would be, again, not just speaking about schools, but as far as the community, we have heard, and I think it was actually addressed pretty eloquently, but we have heard that the numbers in Goshen County are low. So in your opinion, besides the hand washing and even the vaccine, I mean, what other measures have been actually taken to help in lowering those numbers of COVID?
Certainly the making people not join in social gatherings after church has had an effect positively on the COVID exposures. It's also had a very negative effect on the people that are lonely and need the social interaction.
Right, I'm just speaking to what else would you attribute, or what do you attribute the numbers of COVID being lowered in Goshen County?
When we started out, we were aiming to lower the flattened curve. Goshen County had a pretty good curve there for a while, a pretty spike. I think it probably ran its course.
I will say that the masks have helped to slow the spread. It doesn't prevent COVID, but it has slowed the spread along with the other universal precautions like hand sanitizing, social distancing, and so on. So yes, the masks have helped to slow the spread.
Thank you.
Are there any other? Along those lines, we have been presented with the petition, and I wanted to address that real quick too before we got off this topic. So I'm going to read this section out of the Wyoming statutes that deals with how we handle petitions. So this is section 21-3-110C.13. We are to consider every petition presented to the board and subscribed by at least 5 citizens of the school district, and take some action on some petition within 30 days after it is received, provided that no action shall be required if the precise questions presented by the petition have been considered and acted upon by the Board of Trustees and at a meeting held within the current fiscal year. So based on that, and because we're having this discussion now, we are addressing this petition. Is there any other discussion?
Mr. Chairman, and Superintendent Kramer, you can probably supply some information on this as well. How many, we have a number of medically fragile or susceptible students in each building who may have to stop attending face-to-face if masking is no longer required. Do you have a sense of the number of students that would impact in that way?
I would only be able to provide a rough estimate, as some are having within the special education program possibly, but others may not be, and so they might be as evident in relation to that. But my best guess estimate would be between 30 and 40 students would certainly be having to consider if a mask variance were applied for and then in turn granted to determine if it was safe for them to attend. In many of those situations, doctors have given recommendations to the family and given approval for those families to attend because of the mask requirement in their schools. And so they would have to make that decision as whether they would be able to continue to attend or they would have to go back into a remote or virtual learning opportunity.
Thank you. And do you have any sense of how many of our employees that exist in the same situation?
I would not have an exact number on employees. Unfortunately, the only number that I have pertaining to employees is the numbers that I've chosen to vaccinate. I did have a couple of inquiries in regards to that, in what plans the district would have in place if an employee felt that it would be too much of a risk for them to perform their duties.
Thank you.
Any other discussion?
I just have a few comments. So a couple of things. The school board service that we all embark on is carried out to do what we feel is best for kids. So I want to thank each of you tonight for voicing your opinions. Also, I want to thank those who took the time to write some very eloquently worded emails. We received a number on both sides of this issue from staff and from the community. Wow, I have to be louder. But I think it's important that we recognize that not everybody has to hold the same opinion and that we can be respectful of each other through that differing of opinion. I think it's also important as we consider this to recognize that science does change. The recommendations of professional organizations today may differ from what the science and the recommendations of the same professional organizations have tomorrow or in a month from now. It's surely changed from what it was a year ago. However, the CDC, the nation's top organization on disease control, supports universal masking in K-12 education, as does the American Academy of Pediatrics, the American Academy, of Pediatrics, the American School Nurses Association, and a number of our community members. Like I said, we received that same sentiments on both sides of this issue. And so I think it's just important that we hear both sides of these issues as we consider this and every other issue that comes before the board. With that, I thank you.
Mr. Hager.
I just had a couple points here. First, bottom line is I feel there isn't one person sitting up here at these tables that's qualified to make this kind of a health decision for our district. That's why we have county health officials. That's why we have doctors. That's why we have state health officials. All we're doing on the board is deciding whether to apply for this variance and give our metrics and our data to the health officials and let them decide what's best for our district. So that's what I'm in favor for, giving our data to the professionals and letting them make their decision.
Mr. Chair.
Mr. Sussex.
I want to call for a roll call vote.
Noted. Mr. Freeman.
Thank you, Mr. Jefferson. I want to first thank everybody for their opinions. They've eloquently spoken and well done, and I appreciate that. It did a very nice job. I want to reiterate two major concerns that I have. I'll keep them relatively short. It mirrors the prom and graduation pieces in quarantine. If you will remember back in November in our board meetings and going back into those quarantine scenarios where we had to have those conversations, including our school nurses with families, and had to have a high number of students quarantined. We have only had one day this entire school year that we have not had a student in quarantine. One. Now our number has gone down, but we have only had one day, and that was last Tuesday, where we did not have a student in quarantine. Other than that, we have had students in quarantine every single day of the school year. And like, as Mr. Jefferson noted, in some cases, the quarantine can be even more disadvantages to a family than actually becoming positive with COVID. I say that knowing that unfortunately, we have lost 27 people in our community. To say that that is a number that anybody should be okay with is absolutely atrocious and sad. And I don't think any one of those family members of them would ever want to say that COVID is not a big deal. It is a big deal. And I don't want to gloss over that because those families are facing something that no one should have to face. So quarantines for prom and graduation. If we move through a variance and then apply, that I sat in a group of seniors about a week ago at awards for sports. And I looked around the room and knowing that if that same event occurred in these next weeks and we had an individual of those groups unfortunately be positive with COVID, the number of students that would impact on having to sit out for possibly 10 to 14 days as they were ordered for quarantine because an individual who chose to not wear a mask, which is of course, I don't like these. I don't like them at all, but they are a necessity in regards to quarantine. Because if I don't choose to wear a mask, if I choose, Mr. Trustee Miller chooses to wear a mask, and I'm positive, even though he made the choice to wear a mask, he has to quarantine. Because his mask or my mask, his mask only prevents me from being infected, not himself. It doesn't provide the protection for the individual. The other piece that I think is an important factor is the potential, and this is a minimal financial piece, but the loss of ADM. Average daily attendance is how we are funded at schools. If, as I referenced earlier on Trustee Patrick's question, there is a potential of loss of students. I have absolutely been devastated every single day throughout this school year, knowing that a number of our students were not able to attend because of our mask mandate. And that is absolutely, truly unfortunate. And I feel terrible for those students that have had to make the choice that didn't get to come to school because of the mask mandate. What I feel even worse is to add that number of students that we lost at the beginning of school year because of the choice that we made in state health orders. And then we added 30 to 40 other students for the remainder of the school year because we made another choice on having a mask variance and the financial loss that could impact. The piece of testing data also concerns me in relation to what happens in a situation as Heather Saul referenced, when we don't have a mask variant. How many parents who have a child that is home with COVID are showing signs and symptoms of COVID, not going to take them because they're going to worry about having to have a large number of students in their classrooms quarantined. Because if my child comes home with signs and symptoms, I'm going to be less likely to take them to be tested because I don't want the kids in their class to have to be quarantined. And so on, it acts like a domino effect for a benefit of 33 days of the remainder of the school year. And I know that is significant to some, and I don't disagree that it would be nice to be able to finish that. I don't disagree with that same sentiment. But for 33 days of adding some clarity for some families, of adding hope for our seniors and juniors that we've done so well to be able to explore and absolutely accelerate these opportunities of prom and graduation together where they were scheduled and our spring activities that we didn't get to hold on to. I worry that we'd be trading in those 33 days for something that we could lose and the potential for that. The last thing I want to kind of say, and this is off topic, and I apologize, Chairman, if this is, I really kind of, as I referenced before, I greatly appreciate the speakers because they were so eloquent, including students and community members. I am disappointed in us as a community, though, that we would put people in isolation by applauding for some and then not others. I was really hopeful that even though that we'd have disparaging views, that the one person would at least get an applause. Not to say that that means a lot, because I think that is nothing, but we are better than that as a community. We're better at that than what I saw. And asking others to stand up and separate ourselves, that seems to be a mob mentality. And that's not what we're about as a community. And I'm disappointed in that, even though I respect every single person here and I respect your opinion. So I'll stop with that. Thank you.
Mr. Kramer, to your point about quarantining students because they tested positive, my son went back to school in October because he disagreed with the masks and he thought he needed education from the teacher. He had been diagnosed with hay fever, big fancy word for hay fever. He was still asked to quarantine. He did not get to go to school. He did not have COVID. Mom and dad didn't test positive because he didn't test at all. He had no symptoms. But my son's education was halted. So to your point of, we don't want children to miss school.
Okay.
No.
Well, the public forum was earlier, you kind of.
Public forum was earlier, and now there's a lot of points.
Yeah.
Well, we're not going to disregard the fact that other students are still not meeting students.
Ma'am, we can talk about this after, but that's.
We certainly can.
Okay, but, okay.
You have to live with your
No, we're trying to have that discussion, but now we're trying to get to a point where we can come to a decision. So we're.
Ryan just made it uncomfortable. He just divided the congregation.
Okay. Okay, all right. So let's vote.
Chairman Jesperson, before we take a vote, I just need to be clear on what we're voting for.
Sure.
In Niobrara County School District's variance exemptions from section, Health Order 1, section 5, items A through G. Are we requesting the same exemption, or are we requesting an exemption for Health Order 1, section 5, letter C? And yes, letter C and E potentially.
Okay. So I believe that the original motion was to apply for approving a variance regarding the wearing of face coverings, which would just apply to, what is that, C? Now, Mr. Cushman, was it your intent to, when you made the motion, to apply for the variance for A through G?
Yeah, A through G.
Okay, as similar to what Niobrara County did?
Yes,
Okay.
that's correct.
Mr. Sussex, since you seconded it, is that also your understanding?
Yes, sir.
Okay. Okay. Vote has been called. We're going to roll call. I will start. I vote yes. Trustee Boynton.
And we are, the motion
Oh.
was to, please read the motion.
Sure. The motion is to approve applying for a variance to the State Health Order number 1, paragraph 5, provisions A through G.
Nay.
Mr. Cushman.
Yes.
Mr. Miller.
Nay.
Mr. Hager.
Yes.
Mr. Salcedo.
No.
Mr. Schmick.
Yes.
Ms. Patrick.
Nay.
Mr. Sussex.
Yes.
The motion passes 5-4. Okay, so reminder, folks, and I appreciate, again, to echo the comments, I appreciate everybody's contributions tonight and everybody who's emailed us. Please remember that this does not go into effect until we get an approval back from the state health office. So that means until that point, we still have to follow the same rules. And so I would please encourage you to continue to follow those rules until we get a decision back from the state office. Also, I would also just implore you, support each other's decisions that they make. Because this is hard enough as it is. We all have to live together. So let's be supportive of each other and let's do what we can for our kids to make sure that we can finish out the school year strong. Moving on, item F, consider approval of eliminating COVID-19 emergency paid sick leave. I'll wait until the room clears.
Yeah, thank you, Mr. Chairman.
One issue.
Item F, consider approval of eliminating COVID-19 emergency paid sick leave and Emergency Family Medical Leave Act to district employees after March 31st. That is the recommendation is to approve eliminating. Can I have a motion, please?
So move.
Thank you, Mr. Cecito. Can I have a second? Thank you, Mr. Hager. Any discussion?
Chairman Jefferson, if I may.
Yes, please, Mr. Kramer.
So we had talked about this in our December meeting, I believe, or January, just to recall, it was 9th of January, about the extension opportunity. There is a further extension of this leave, but the reimbursement, I believe, is the equivalent of $6, if I remember correctly, per day. 6.2%, which equates to minimal reimbursement that does not even approach what the cost of a substitute is for that date. So it is one of those situations in which it is not financially viable for us as a district to maintain that. Also, in stating too, there have been other situations that have allowed us or increased the availability with the sick bank being still available to employees, that we feel that we are covered for the remainder of the school year in regards to appropriate coverage for staff members who may test positive for COVID or be in a situation where a family member tests positive for COVID-19.
Any other discussion? All those in favor of approving eliminating the COVID-19 emergency paid sick leave and emergency family and medical leave act to district employees after March 31st, please signify by saying aye.
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 All those opposed, aye. I'm going to call for, am I the only one that voted no?
I think so.
Okay. 8-1, Jefferson.
Are there any abstentions?
Oh,
Mr.
thank
Chair?
you. Were there any abstentions? Thank you. Okay. Item H is the work session for board discussion on preliminary district budget and funding. We're going to move into a work session. For those of you who do not wish to stick around for that are welcome to leave. Otherwise, we will start that now. Recess has been requested for 5 minutes.
So Miss Kate, you bring up a good point. It's about starting this now. I thought about this as we were approaching this evening and knowing that we were going to have a number of things on our plate, and considering that it is now 9:30. But you had made the comment about legislative process kind of being bogged down. So are you ready tonight to proceed with the discussion that you feel needs to happen?
I'm ready to give you a brief update. We're not in a position to talk dollars and cents, but I have no problem giving you a brief update.
Okay, let's start there. And I guess if there's more questions or things that come up, we can work towards that. And Mr. Kramer, feel free to.
No, that's exactly as Kate and I referenced today in our discussions. She's got a great update for us and provides us all the valid information that we have at this time. I think it's important for trustees to hear that information.
Thank you. Go ahead, Ms. Cates.
I provided a memo with your packet, and then I also left a two-sided document at each of your places prior to the meeting. What we have is we have House Bill 173. And House Bill 173 did go through the House with a number of amendments. Some of the amendments failed. There was a very strong amendment that was incorporated into House Bill 173, which is the existence of the bill, as I have information to share with you tonight. The Senate has looked at the bill in the Education Committee. It has not reverted to the Senate as a whole as of yet. So that's why I share with you that we don't have dollars and cents to discuss tonight. The dilemma that we have is that Cheyenne had the snowstorm bigger than what Goshen County had. The legislature was supposed to conclude on Friday, and because of them having 2 snow days, they aren't scheduled to conclude until next Wednesday, the 7th. Having shared that, and as Mr. Kramer and I have talked on our meeting the 13th, there's going to be more definitive information for you as to what education funding will look like. House Bill 173, as it went to the Senate, had some very positive things in that the funding model was restored back to its present sense. That meaning the allocations for different instructional categories, utilities, all of that was restored back to its present form. One place where I really believe we'll see a reduction is that there's a allocation for health insurance for our staff members. And what happens is that the model provides for X number of employees, and because of people's personal ability to have insurance through spouses or whatever, we have a situation where we are insuring less people than what the model is providing. The legislature refers to that as ghost employees. And so what they're looking at is scaling that insurance allocation back, meaning that because it's a block grant, we got up to thousands of dollars. It was about $12,000 last year per employee that was included in the model. When I look at the calculation, it's going to be figured out over 3 years. So it's a scaled in reduction, but that for the first year will probably yield us a reduction of $125,000. The very positive thing when we talked about at our last work session was the district's cash reserves. And I shared with you because of COVID, we had the situation where we may very well go over 15%. And if we go over 15%, we end up sending money back to the state. House Bill 173, as the Senate is starting to work it, increases carryover to 30% for the next 5 years. So that gives us an opportunity to utilize that carryover to make baby steps instead of very drastic effects. The other reduction that we as a board and administrative committee talked about was the next round of CARES money. And that now is being called the American Recovery Act Plan, ARP money. Their House Bill 173 is using that to backfill the education funding. So what is happening if House Bill 173 stays in its present form, we would get the ARP money, which we have approximately $3.2 million that we anticipate receiving. 80% of that would be reduced from the funding model. So districts would really only keep 20% of that American Recovery Act money. That's how they're keeping the funding model whole in its present form, is taking 80% of that American Recovery Act money back to the state. Sales tax, prior to the WSBA committee, there was conversation as WSBA was looking at a bill in their delegate assembly. House Bill 173 at one point in time had a 1% sales tax included. That 1% sales tax kicked in at the point of LISRA. LISRA is the rainy day fund, the Legislative Stabilization Reserve Account. When the rainy day fund dipped below $650 million, a 1% sales tax was to kick in. The amendment reduced that to 0.5%. And now when the Senate Education Committee looked at it, they don't like the idea of a sales tax or being tied to a dollar amount. Some of the conversation was that it should be tied to a date as opposed to a dollar amount. Goshen County at the present time is not affected, but there are also, right now, nothing financial, but there's direction of a consolidation study. The intent of the consolidation study is looking at those counties that have more than one school district and reducing that to a lesser number. The big one being Fremont, and the study ramifications had ideas about the reservations having a set number of districts versus the Fremont public schools and that type of thing, but we only have the one school district. And then it has the potential to help us a little bit in that when we talk about students and we talk about ADM, presently for a student to be full-time, they have to be 75% enrolled in courses and attending. Excuse me, they have to be 80%. The change is to reduce that to 75. So a student would be considered full-time a little bit sooner. The items that have not yet been addressed and that are very important, being transportation and special ed. And House Bill 173, as it first was presented prior to the amendments, had the ADM calculation as opposed to being on a 3-year rolling average. It was just going to have a 2-year look back period. So, there's some of those kind of things COVID related that they are looking at and considering. Right now, I feel very strongly in saying that we have 125,000 based upon the health insurance piece. And we probably need to figure 450,000 based upon the ADM reduction that we were looking at. So, you know, that's 575,000. Are there items you guys are hearing, seeing, things I can try and clarify?
So I have two questions. Oh,
Go
excuse me.
ahead.
I apologize. The first is just a timing thing. The way I understand it, the final day for third reading in the second House, meaning if House Bill 173 passes, goes to the Senate, it wouldn't be potentially acted on until the 6th of April. So from a scheduling standpoint, we have salary relations to occur on the 6th and 7th. Will we even have an idea at that point, not knowing what the legislature has done in order to take action on that day?
I've had conversations with Mr. Kramer, and I'm going to allow him the opportunity to speak as well. Having sat on salary relations, going on 12 years, and you know, several different superintendents boards, thought processes. Last year, there was not an opportunity for those non-salary items, those non-dollar pieces that people have an interest in talking about. So I do see it being a benefit of being able to gather and talk through some of those items that people have an interest in discussing. But to your point about the actual dollars and cents, I've expressed a desire with Mr. Kramer that we look at a finalization session, at which point, you know, they can have expressed their interest, they can have given me all sorts of ideas, I can have scenarios ran, you know, when we get in salary relations, people have all sorts of ideas as far as, you know, this change or this modification, and hopefully they can be open with the process and talk through those pieces, that then we can have a finalization session when the money is known, and we can truly wrap it up and get a recommendation to the board, probably with the May board meeting.
Thank you. The only other question I had was the House Bill 162, I believe, is related to the expansion of Medicaid. A lot of states, school districts are impacted positively through Medicaid funding. Do we know what that funding would be for our district, specifically for those special education and high medical needs and healthcare needs students?
Yeah, I can. So in reference to that, the model in which the state has undertaken in regards to Medicaid reimbursement for the school isn't really clear on exactly what impact that would have locally. There would be a significant impact statewide in what model they had first presented and discussed last year. So I think there is potential there, at least in my estimation. If nothing else, if that Medicaid were to move forward, then the opportunity for maybe even further years of not having to set a limit on special education funding or have more availability of dollars is certainly higher by doing that within the model. But I don't think we would see a significant impact locally. But an extension of the current structure of special education, even for 1 year, would be a huge benefit for us.
Thank you.
Mr. Sessom.
I was just curious. I've heard some whispers that there's the potential of a special session during the summer to address more of this education type stuff. Have you heard anything that could happen with that in relation to the American Rescue Plan funding and how that's going to come to the state and then because of that come to us, how that's going to be structured and stuff? Have you heard anything about any of that?
Yesterday, there was conversation in regards to Superintendent Balo's recommendations as to how that would look, just based upon the legality. and the need to add some dollars for district audits and that type of thing, just to make sure that everything is clean. There are supposed two different rounds. So there's ESSER or CARES 1 that we already received. There's this one we're talking through here, and then there's the third one. So I think they're talking about interim topics. I really think that education is one of those pieces that they can talk about future, but they have to make some decisions in my opinion now, based upon some of the timing that we're faced with. One of those pieces being the April 15th date for having to notify certified employees of future employment. But I don't think they know what all interim topics they're gonna deal with.
Well, what I was mainly was the two items that weren't addressed, the transportation and the special ed funding. Those are big ticket items that I think that they're gonna have to address sooner rather than later as well.
Mm-hmm. Yeah, you're exactly right.
Yeah, I would agree. I haven't heard any rumors or anything like that, but I would completely agree and advocate if it's a one or the other, if they actually, special education one is the one that is the hardest in transportation. We already had discussions about there are cost-saving avenues that we can proceed down for transportation, from our extracurricular activities as we've seen, and in respect of there's some things that we can have discussions about to reduce transportation. Special education is that much more difficult one that tends to create a lot more difficulty when we're talking about it. But the CARES dollars will be a definitely hot topic, and how I think the state chooses to mesh those is what's going to be interesting too, because there's a lot of discussion on the 80-20 piece. It could be very interesting, and I think the picture from where it was 2 months ago or even 8 weeks ago to where it is now in regards to being able to utilize that, I think we are in a much better position than I'm feeling. At least sky is not falling at this time, as I was worried it might 8 weeks ago.
Well, and I think one of the issues and part of the American Recovery Act is you go out there on the federal website and they have their ideas and their guidances how the funds can be spent, but yet the state has not yet directed districts to how the funds can be spent. So they need to mention some of that together for us.
So essentially what this does is it buys us time and helps us a little bit with what our budget shortfall would be. It helps a little bit with that, and it buys us a little bit of time, as far as what our funding is.
I think the biggest piece is the carryover piece. And if you have any opportunity to visit with anyone in Cheyenne, that is the piece that I've really been pushing, because I see that as they're looking at the health insurance as a 3-year staggered, a third reduction, 2/3 reduction, and then the full effect in year 3. By us having some added carryover above that 15%, that allows us, because of such short notice, to be creative this year and then, have some time to make those tough decisions in the future.
And I appreciate that. And the one thing, I guess, my concern has been, even from the get-go, when we started talking about budget reductions, was the impact on our various programs throughout all of our schools, top and bottom. And I would just, I guess, my personal preference would be not to cut entire programs, but to find ways to spread, if we have to spread that out as best as we can. And that's more big picture, 30,000 foot view. Just because I've heard some rumblings about some things in regards to certain areas. And I think once you start focusing on certain areas, that's a slippery slope.
Yeah, I think that's an excellent point. Chairman Jefferson is we have not, and you're going to hear all sorts of rumors. I mean, you're going to hear we're cutting so-and-so, we're consolidating. I'm gonna tell you, everything is on the table and nothing's on the table, you know, because we do have to have those creative conversations where everything, and in fact, you can tell people that until it comes to you as a board trustee, as a recommendation, it should be considered that be a rumor, because you are the keepers of those things. And as we set goals and priorities around that, that will be important to really strengthen people's resolve, because there will be some conversations that will be ugly and that will affect people's livelihoods, and that's going to be uncomfortable conversations, but they're also ones that if we're going to come up with innovative ways to move through this and provide the best services we can for kids, it's best that we have those conversations on a wide level to think of everything.
Thank you. And that was another point that I was hoping we'd make is what happens when we get approached with some of these rumors. So, and I get that question from a few of you on what are we supposed to say in certain events. So, and I appreciate the fact that you guys want to approach the public with the correct information and not just conjecture.
And I always appreciate too, if you do have those specific questions, asking me via email or anything else too. And I'll let you know as soon as I possibly can as to whether there is validity in that conversation or where it might be one of those that was just mentioned in passing, and if we're truly looking and feel that it's viable.
Well, and for those of you that are new this year, for your information, when we're talking salary and benefits and the collective bargaining process of salary relations, that group will come out of there with a recommendation, but it's not approved until that recommendation comes to the 9 of you, and you decide if, you know, based upon this recommendation and at this cost, if that's something that can be substantiated. So you should not feel like you don't have a say in what happens in salary relations just because you weren't sitting in that room.
And then to that point too on salary relations, because that meeting Mr. Miller alluded to, it is April 6th and 7th. And I have forgotten who is on that committee. And also in the discussions about trying to figure out who that was, it has been my past preference with the spouse as an employee to not participate in that. But in discussion, you know, where you're affecting a larger group than just yourself, that, you know, there's still that perception of self-serving, but I would be, if someone who is on that committee who desires to not be anymore, I would happily step in to help in that process, considering my background. So, does everybody remember who was on salary relations? I apologize for. Of course you do.
Trustee Miller, Trustee Patrick, and Trustee Soseda.
Well, I'll offer to anybody who feels they're over or there's a little stretched too thin with whatever's going on in your lives. I would happily step in. So just let me know. But we'll proceed forward with those three.
The other thing that I don't think you have to make a decision about tonight, but prior to the finalization, you're going to want to start some conversation in regards to carryover. And, you know, we talked about being at an 18% carryover based upon the additional expenses that we didn't incur. But the three of you on salary relations, it will become invariably a conversation as to how much carryover can be spent on next year's salaries. Just so that everybody is thinking about that.
And for everybody's reference, Marcina has put in spot, please tell me if you don't remember offhand. Each percent represents approximately what amount? I know you gave that information a while back, but I can't remember off the top of my head. 1% is roughly
right at 300,000.
It's Kate's. When we discussed that, we discussed, having to stay under that 15%. We discussed pre-purchasing some things and doing some things to try and get under that. If this goes into effect, is that still something that we're looking at, or what, I guess, what's our plan for that extra, that carryover?
The document that I shared with you, I was projecting about 800,000 to 900,000 of expenditures that we didn't have because of COVID. A lot of them being transportation and activity related. There are some prepaid options. There's not 900,000 in prepaid options that I think that when we get ready for that, maybe that's a budget committee decision, because those things are going to be things that we have to pay for. It's going to be things like property insurance, that either we pay that in June or we have to pay it in July. There was a lease payment, our last lease payment that I said we could have made this year. It's due in August. My recommendation would be we simply make that payment in August. That, I guess if carryover goes to 30% from a financial statement, financial analyst type position, I probably would advocate not to prepay those things, because we end up having to back them out of 1 year and show them in the correct year.
We've also been working administratively on some things that we could take a look at in case we get to those situations that we'd be presenting. And again, I know what legislators really want to hear is from you and in your experiences. So if you do have an opportunity or you need contact information and are willing to just write a quick note to them, they listen a lot to elected local officials in regards to the impact that would have. And so it is very important in this situation, but we will have, even if it doesn't, we will have a plan to be able to spend as much as we possibly can in relation to spending ahead.
Just one quick comment is, and this year you could have done nothing about it, but the concern that I've had each year going into salary relations since I've served on the board, so this is my fourth salary relations, I believe. Maybe. It's either 3 or 4. But is we lose the confidence of our teachers, because each year we've gone in telling them that we're spending into reserves. And yet every year we come in with it, we end the year better than we projected. And so while I appreciate a conservative budgeting approach, I think we need to be extremely realistic where we can be, because otherwise I do think that becomes a continual, yeah, you said we were going to do that last year, but why don't you just let us spend another $1 million into reserves, because we know that never happens. And that's the feedback that goes on in that room. That's the teachers that sit in that come back to me is, it is just that, right? I think there's a distrust in that we are making it appear that the budget is worse, the budget situation is worse than it is. This year we were unlucky, in that the state has said we're going to have these future cuts, but we just don't know what that is. And so we'll be able to talk through that a little bit. But I think just that piece is pretty important as we move forward. But I may be one of 9 that has that opinion.
Well, and I can speak to it, and I totally appreciate what you're saying. I think we have to, as a district, look at our carryover trends. And we did have a few years where it was a negative type scenario, but we've had positions where we budget for, and for whatever reason it's chosen not to fill, or we're planning for a position and can't find somebody, or there's There's lots of quirky things, so.
Well, I think it happened even with the state this year. You know, we heard gloom and doom, gloom and doom, gloom and doom. And then, hey, we're going to raise the base salary of teachers. And teachers went, what?
Insurance is the hardest part when it comes time to budget because you're dealing with a potential $15,000 spread one way or another, depending on if they choose to take insurance. But I do appreciate the comment, and you're spot on.
Is there anything else? Okay, one thing I wanted to say, and it's not related to budget, and I didn't want to say this with a bunch of people in the room. Maybe I should have though. There's an impression in our communities that the 9 of us up here, especially concerning the issue we face tonight, already had our minds made up. And that seems to be the opinion on a number of things that we deal with. Even to the point where I think Mr. Miller gets a bad reputation in town because of his position at the hospital as related to the specific issue tonight. And I'll even say there's been comments made about the 3 that were quote unquote elected to do or do what they were elected to do. I will say about the 4 new trustees that I've been impressed with the way you take information and process it, ask questions, make comments, and whether or not you have your mind made up or not, you still take into consideration the opinions that are expressed. And I have publicly defended all of you in that sense that whether or not we have our minds made up on an issue, we represent different factions of groups in our communities. And so while maybe Mr. Sussex's opinion might be different than mine, I represent a different set of people than maybe he represents, and that goes up and down the line here. So I will say to all of you, thank you for what you do. We make tough decisions. We have to represent people that don't always agree with each other. And we do that to the best of our abilities, because I think that's what our mandate is to represent and to make the best decisions for our schools and our kids. So to that end, I thank you for your contributions tonight and for your contributions on this issue, on all the issues.